Newborn screening is something that most of us probably don't give much thought to. Even as new parents, it's just another check on a long list of checks to make sure everything with baby is all right and as it should be. Most of the time, our doctor or nurse will say everything is okay, after which parents can breathe a sigh of relief and then get back to worrying about, well, let's be honest, everything and anything else.
So newborn screening, it affects everybody. So we know that every single child that's born in the UK already gets screened through the blood spot test after 5 or 6 days. No one ever thinks it's going to be their child that's going to have a lifelong condition. So it's really important that we continue working together so that all of these rare diseases and people who have these rare diseases have the best chance to survive, and not only survive, but thrive into the future.
In the UK, we screen for just 9 conditions, far less than many other high-income countries, which is why the Newborn Screening Collaborative are pushing to promote the benefits of early screening, which they say can improve health and prevent severe disability or, in some cases, even death.
At that time, my son was diagnosed in 1995 with adult onset MLD, which is very rare. There was no support, nobody had ever heard of it. No doctors had heard of it. It was completely unknown. Luckily, I had a friend doing postgraduate research in America, and I managed to get my son a bone marrow transplant first in the UK, so he survived. But so many little ones, it's so much more aggressive, the late infantile version, so aggressive that they have very little chance of surviving. So we just intended to support families through those terrible years. Initially the diagnosis, which is life-shattering. It doesn't just affect the child, it affects the mother, father, the siblings, the whole extended family. And our intention was be there, support them, give them any help we could, help them get in touch with the right doctors, the right clinics, and make the child's life as good as it possibly could be for the short time they're around. Then there was this wonderful opportunity of getting gene therapy, and we battled. Several organisations, not just ours, several organisations battled to get it, and finally in February 2022, the NHS gave us gene therapy so we can save children. The disaster of this situation is the therapy doesn't work once the symptoms have started to show. So you've got one child diagnosed, no help. The sibling tested, having MLD, able to have gene therapy. We're losing one and saving one. I think it's absolutely criminal that when a rare disease has a cure, that the government aren't allowing us to use newborn screening. They're actually killing children, knowing there's a cure. And I just don't see how anybody can accept that. The method of getting onto the heel prick test is no, no, no. Every possible obstacle they can put in place is there. We test for 9 genetic diseases in this country. 9. It's scandalous because, okay, the treatment costs a lot of money, but look what you're saving in the cost of looking after a child for 10 to 15 years. The family disintegrates, the siblings are pushed to one side. It just cannot go on like this, and we've been working hard with ArchAngel Foundation to move the newborn screening application forward. We just have to get it. There's no excuse. We have a cure.
Georgina Morton, founder of both the Newborn Screening Collaborative and the ArchAngel MLD Trust, thinks that the current UK National Screening Committee may be holding us back.
Unfortunately, the UK newborn screening programme is lagging behind that of many other high-income countries and is frankly somewhat of an embarrassment. We have some of the best scientists in the world developing cutting-edge treatments and groundbreaking medicines, yet inefficient and outdated processes and bureaucracy means that we are failing to keep pace with these rapid developments in science and technology. This results in significant inequity to our children. This also inevitably impacts enormously on each patient's family. With parents taking on most of the care duties, their lives are entirely dominated by MLD. This has an extremely detrimental effect on their mental health and well-being, on their employment and finances, on their independence, their relationships. Siblings have to endure watching their brother or sister lose all of their ability. They become second best because their parents are always caring for their poorly child. They miss out on normal things, and they just lose their own entitlement to a normal childhood. These families are grieving from the point of diagnosis for the rest of their lives. Newborn screening has the power to eradicate all of that in one tiny heel prick. Why wouldn't we do it?
We wouldn't even be able to have the newborn screening conversation if we didn't have treatments available. And I think that's where we're in a really fortunate position with people who have SMA, is that we now know that if you intervene really early, so children who are given the newborn screening test at the very, very beginning, we can bring in treatments, some of the life-enhancing, life-changing ones within the first couple of weeks, and children can go on and in some cases develop without any symptoms at all. So we obviously realise that the newborn screening will have a cost implication, even though it's added on to the existing blood spot test. But if we look at the cost savings, there have been a number of cost modelling done, and the government have to do this by pressing go on the newborn screening, because ultimately we are withdrawing that process. There is a treatment available, and it's really immoral that we are not putting the newborn screening programme immediately, because we know the treatment's there already and it works.
Families affected by rare conditions often have to endure long and challenging journeys to a diagnosis in which time, health, well-being and outcomes are made worse. The Newborn Screening Collaborative believes it doesn't have to be this way.
Each small charity like ours has limited resources, very limited resources. But between all the charities that we network with, there are some very powerful speakers, some very intelligent people, some great campaigners. And when you put those people all together, you come up with something very powerful voice that can speak to governments, to health systems and to all sorts of areas, drug companies where necessary. And it's quite amazing to work with these groups. Gosh, got emotional.
In the rare disease space, we want to focus on the similarities rather than differences. We're aware that children with heart conditions often develop comorbidities and other rare diseases, which is why we're working collaboratively with the group to ensure that their expertise can be provided for those in need. Don't underestimate the power of your voice to contribute to this campaign. Please get behind us any way you can.
Nobody knows about rare genetic diseases until it hits their family. I'd never heard of a leukodystrophy. I'd never heard of rare diseases until my son was diagnosed. But the thing is, you could be that 1 in 100 people who carries that gene. You could meet with someone else who's the 1 in 100 who carries that gene. You won't know unless your child is tested at birth. We have the test, it works. We know we can do it. So the collaborative isn't just about metachromatic leukodystrophy, it's about all the rare diseases. Some of them don't need a cure, some of them just need management. And if you don't put that management in place at birth, the child will degenerate. So it's not just about our cure and MLD, it's about all the rare diseases that need help. It's the most awful suffering knowing you can't do anything to help your child. All you ever want to do with a child is make it better, kiss them better, find a cure, do something. But with MLD there was nothing. But now we have it. We must get newborn screening. We must.
You can make a change by supporting the charity's efforts online and on social media to make sure their community voices are heard and positive progress is made. Let's speak up for those who don't yet have their voice, before it's too late.